Hello and welcome. Today, we're going to tackle a topic that a lot of people are curious about, but let's be honest, it can sound a little intimidating. We're talking about egg donation. Our goal here is to break the whole thing down, step by step, and just demystify what it's all about.
So, have you ever wondered what the journey is really like? Maybe you've thought about it yourself, or maybe you're just curious about the science and the experience behind what is, an incredible gift. You've probably got questions about the time commitment, the procedure itself, and what it all means for your body. Well, you are definitely in the right place. Before we dive deep, let's just get the biggest questions out of the way right up front. The main prep time, just 2 to 3 weeks. And the actual procedure? Get this, it's only about 20 to 30 minutes long. It's considered very low risk, there's minimal discomfort, and the recovery is super quick. Most people are back to normal in a day or two. And here's the big one. It has zero impact on your future fertility. We'll get into why later, but it's so important to know that from the start. So here's how we're going to walk through everything today. First, we'll talk about what this gift really means. Then we'll cover the prep phase, the retrieval procedure itself, and of course, the recovery journey. And we'll wrap it all up by tackling those big concerns head on.
All right, first up, a generous and safe gift. Because it's really important to see this as more than just a medical thing. It's a decision that has a massive, profound impact on people's lives. It helps create families.
So what is it exactly?
Well, at its core, egg donation is the process where mature eggs are taken from a donor's ovaries to be used in treatments like IVF. And let's be super clear, this is not some experimental thing. It's a widely practiced, well-established procedure that specialists perform every single day in fertility clinics.
Okay, now let's get into the nitty-gritty. How does this all work? That brings us to section 2, the preparation phase. This is that 2 to 3 week period that leads up to the main event.
This timeline breaks it down perfectly. It all starts with daily hormone injections. These help your ovaries produce more eggs than they normally would in a month. Then you'll pop into the clinic a few times for monitoring. They just use simple ultrasounds and blood work to see how things are progressing. Around day 10 or 12, you'll do one final injection called the trigger shot, which gets the eggs ready. And then, about 2 days later, it's time for the retrieval. So what's your role in all this? Honestly, it's pretty straightforward. Your main job is just to follow the plan. Give yourself the daily injections, eat a healthy, protein-rich diet, and stick to gentle exercise, so no intense workouts for a little bit. And because you'll be sedated, you'll need to fast from midnight the night before. Simple as that.
All right, we've prepped, we're ready to go. Now for the main event, the retrieval procedure. Let's talk about what actually happens on the day you go into the clinic.
The day of the procedure is surprisingly simple. You'll show up at the clinic, check in, and get prepped. Then you'll get some anesthesia to make sure you're totally comfortable and asleep. A specialist then does the retrieval, and afterwards, you just hang out and rest at the clinic for about an hour before you can head home.
And that retrieval part, the main event, it is unbelievably quick. We're talking 20 to 30 minutes tops. So while you might be at the clinic for a couple of hours total, the procedure itself is over before you even know it.
Now let's talk about that anesthesia, because I know that can be a worry for some. It's called twilight sedation. This is not the heavy-duty general anesthesia you might be thinking of. It's a much lighter form where you're asleep, you're totally comfortable, but you're still breathing all on your own. It makes the whole thing completely pain-free without the intensity of a major anesthesia. The procedure's done. Now what? Let's move on to part 4, your recovery journey. Let's look at what you can expect as you get back to your normal routine. Right after the procedure, you'll probably feel a little drowsy, and maybe you have some mild cramping, kind of like period cramps. Over the next few days, you might still have a little bit of bloating or tenderness, but it's nothing that some over-the-counter pain relievers can't handle. To have a really smooth recovery, the guidelines are super simple. Rest up, drink plenty of water, and just take it easy for about a week. That means no heavy lifting or hitting the gym hard. But the best part? Most donors feel totally ready to get back to work or school in just 1 or 2 days. And that brings us to our final section, and it's a big one. This is where we're going to tackle those major questions head on: pain, safety, and the really important topic of long-term fertility. This is probably the #1 question on everyone's mind, right? It's a medical procedure, so it's natural to wonder, how safe is it really? Well, this data from the American Society for Reproductive Medicine pretty much says it all. The risk of a serious complication, like something called ovarian hyperstimulation syndrome or OHSS, it's less than 2%. That means that over 98% of donors have no severe complications at all. It's a very safe procedure. And now for the other huge concern, maybe the biggest one for anyone thinking about this. It's a totally valid and crucial question. If I give some eggs away now, will I have fewer for myself later on? The answer, which is backed up by tons of studies, is a clear, confident no. As it says right here, donating eggs does not reduce your overall egg supply. The science behind this is actually so cool. The medications just stimulate a group of eggs that your body was going to naturally get rid of during that month's cycle anyway, so you're not taking from your future supply, you're basically just rescuing eggs that would have been lost. It's why all the studies confirm there's no impact on your ability to have your own kids down the road. So, after all is said and done, what's a typical outcome? Well, a successful cycle usually results in about 10 to 20 mature eggs being retrieved. This gives the intended parents a really fantastic chance to create a family, all from this one, very short process.
And that really brings us back to the heart of this whole thing. After you understand the process, the safety, the science, it all boils down to this one question. When you think about the fact that a single, safe, and temporary process can literally help create a family, the impact is just life-changing. It is an incredibly powerful and generous gift to be able to give.